Hello, RAP students. I'm Dr. Smith. I'm here to talk to you about the skin today. So what people don't realize sometimes is that the skin is very important. It is considered one of the largest organs of the body because it's all connected. It actually protects our tissues on the inside from the germs on the outside. For example, just think about when you get a cut and you have to clean the cut. That's because now the skin is broken and you have the tissues exposed. So now you need to go wash it and cover it so that you don't have the risk of getting an infection in it. So that's what the skin does for us all the time. But it not only does that, it helps us keep our temperature where it should be, so we'll have a normal temperature. And it also gives us a sense of touch. So we're going to talk about that, but first let's talk about how the skin is put together, okay? So there are 3 layers to the skin. The first layer is the epidermis. And I know some of these words can sometimes be kind of confusing or just difficult to remember, but to keep trying. If you can't get the word, keep trying, but try and remember something about the layer and you can connect them. The middle layer is the dermis, and the deepest layer is the subcutaneous fat. All right, for the top layer, this is where we have new cells grow. We have all kinds of skin cells that grow here, and what they do is they come to the top of the surface. So the closer they are to the surface, the older the skin cells are, and that means that they're tougher. They're tough and strong. And we need that for the outside of our body. All those cells are coming up here. These are the new cells. Now also, you have cells that have melanin in them. And melanin is what gives your cells a color. So people that have darker colored skin have more melanin than people that have lighter skin. That also helps protect you from the sun. So usually people that are darker are less likely to get sunburn. It doesn't mean we can't. We're just the least likely people to get sunburn. So you can still get sunburn if you just decide to stay outside and fall asleep and be out for hours. Oh, you can get it. All right. So we talked about the melanin and the cells that come here. Let's go to the dermis. This is the layer that does the most for us. So first, we have blood vessels that run through here. So I'm going to make the blood vessels different colors. Just like on the respiratory video, I'm just going to kind of keep that like that so you think of blood. So when you have blood vessels in the skin, this is when people sometimes get red. That's because of the blood vessels. You have blood that's near the skin. But what also goes with that is your sweat glands. Again, I'm not the best drawer. Sweat glands in that dermis. And they come all the way up to the top. So when you have those sweat glands, once you start getting warm, the blood is flowing through here and it starts to flow even more. Well, there can be release of the water up to the surface of the skin to cool it off. So that's how those can work together. But you also have oil glands in there. And I'm going to go ahead while we're talking about oil glands and talk about hair follicles. Because everybody has hair. I know I'm not the best drawer again, but this is how I'm drawing the hairs. And so with the glands, the water and the oil collect up here on the surface of your skin, and it helps form a nice layer, keeping your skin moisturized the way that it should normally be. And that's what that's for. That's to help protect the skin. Now, the hair follicles that are in your skin, you can look and see hairs, unless you're just a hairless person. There are a few people in the world that are like that. But for the most part, you can see the hairs on your skin. Well, there are some muscles in here. And these muscles that are along with the hair follicles and all that, when you get cold, they tend to tighten. And you can feel goosebumps and your hair can stand up on your skin. That's why that's happening. So all of this helps with temperature regulation of your skin. Okay, now the next thing in the dermis is the nerve endings. We have nerve endings all along in here. These nerve endings are what allows us to be able to feel things. So the information that your skin gets connects to your nervous system, which connects to your brain. And so you know exactly what something feels like. So yes, we have all that in the second layer. The bottom layer is fat, pretty much fat. I'm not going to draw that because I think we all kind of have an idea what fat's like. But it serves as cushion and warmth for us. So some of us are a little bit warmer than others. But that's what this layer does. So let's connect all of this to what you would see if you were going to a healthcare provider. Okay? Okay, so now that we know how the skin is set up with the 3 layers and what's in the layers, we're going to talk about how your healthcare provider can use this as clues to what's going on with your body. The first thing is they can just look at you. They don't have to touch you or anything. If your skin color is different, if you look a little redder, that's usually with lighter skin, you can tell that more. Sometimes people will be really, really pale, or they have bluish skin. Some conditions you'll have yellow skin. It just depends. Also, if they can tell that you're sweating, those serve as clues for your temperature of your body. Also, they can touch you and feel your head. They can feel your hands. They can feel your feet. They can feel different areas of your body to see if it's hot or cold. And that can tell them if you are getting circulation to different areas. Also, some of the things that they can do to test your nervous system happens through the skin. Remember, you have those nerve endings in your skin. So one of them is light touch. So when you are using the skin to test that, they'll have the patient close their eyes, and then they'll ask them if they can feel a certain touch. Now, before you close your eyes, they may say, tell me if this is sharp or dull, and say, this is going to be sharp. I'm just using a cotton ball. You can also use Q-tips, or they'll say sharp. Tell me if it's sharp. They could use a paper clip. There's little neuro tips, as they call them. They have a sharp end and a dull end. They can do it that way. I'll just leave that like that. There are toothpicks that you can use as your sharp end. They'll have you close your eyes and say, tell me if you feel sharp or dull. So you should respond dull, sharp. And if you don't, and you consistently don't answer correctly, they're probably going to do some more tests and further exams on you, just because that means that there's something going on with your nervous system. They can also use something as simple as a Q-tip to test whether you can tell how many points are touching you. They'll have you close your eyes. Tell me how many points are touching you. If they touch you with 1, you'll say 1. If they touch you with 2, you'll say 2. They are testing the sensory part of that part, or it may be something that they're testing for the brain. It just depends. So these are just basic things that I'm telling you. You could also see a type of pinwheel. It's kind of prickly, that they run over your skin to tell them information. This is how the skin can help learn more about your body. And they can use vibration, because you can sense that too through your skin. So it's now vibrating, and they will put it on your skin, and they'll see if you can feel that. They can use it for other reasons too, but they could always use it for vibration, just to see if you sense vibration. These are just a few things that your healthcare providers will look for. And I hope you learned something new about your skin, and I encourage you to continue to learn more. And it was a pleasure working with you. And please remember, it is important to exercise your mind as well as your body. Have a good day.